Good morning, Vilsack Health Clinic. This is Lieutenant Colonel Rainey. May I help you, sir, ma'am?
Hey, Chris. This is Mark. You have a minute? Ever since I hired this one provider, my ice complaints have nearly doubled. I've given this guy ample opportunity to change his behavior, and it's really starting to affect my bottom line on my Apple surveys. He's just not helping my organization move forward. And I was wondering if maybe you had some advice.
Well, Mark, about a month ago, we were dealing with a similar situation.
Sir, I understand patient satisfaction scores need to improve. I realize the direction you are trying to take our MTF, and I'm certainly on board. Seeing these results really let me know where I rate amongst my peers, and I will do all that I can to improve the quality of our service and patient satisfaction.
The data speaks volumes, Dr. Mizzou. I'm pleased to see that you're willing to provide courteous and helpful care to our patients. Our MTF, our staff, and our patients need us to create a positive environment where we're providing great quality care. Counseling our staff and providing specific, detailed feedback by incorporating the Apple scores into our performance counseling has been critical to moving the organization forward. The Apple's data tells us what the patients think about the quality of our services and help our providers to reach their maximum potential. If a provider chooses to ignore what our patients are telling us about the services we provide, then they can choose to change or practice elsewhere.
But what if the next person's worse?
Well, Mark, there's some great tools and resources available from the Decision Support Center at OTSG. They have a lot of data that can help us when we're making decisions about hiring providers. In addition, even during the hiring process, we can be upfront with our interviewees and let them know our expectations in regards to patient satisfaction so that we establish the standards up front before we even hire.
Hey, thanks, Chris. Really appreciate it. Good morning. Thank you for being here. Several conversations about improving your patient satisfaction scores have led us to this discussion. I really feel like a broken record here. We need to improve the way that you interact with patients.
I didn't go to medical school for almost a decade to be criticized by patients who don't even understand medicine. Patients don't tell me how to be a physician. If you don't like my way, I don't really care. Medical establishments depend on doctors, not the other way around.
Well, it would be in our establishment's best interest not to renew your tenure here. Good luck on your future.
Hi, Mark. What can I do for you?
Hey, I gotta tell you, I'm no Bob Dylan fan, but it was like sitting on a barbed wire fence having to endure that provider's behavior. It's like I was being held hostage because I couldn't do anything about it. And you know what? It just wasn't good for business.
Well, I'm glad things worked out for you.
They did, and the scores are getting better and we're moving in the right direction. Hey, you were telling me that you had some experience using the Decision Support Center at OTSG. Since I'm getting ready to hire the new provider, I was wondering if you could help me out, or at least what should I be looking for to make the right decision?